if you notice when we zoom in, you could actually start to see how the canal anatomy looks like. A lot of people complain that, the chambers are different in the ADC exam. But if you closely notice, can you see how the mesiobuccal and mesiolingual is there, and then the distal? You could clearly see the three canals going and creating that triangle. But the thing is that they're very joined together, and that's where candidates struggle when they're doing it.
Hi everyone, Dr. Mac with another video. I hope you all are doing amazing. And for a lot of people who have just passed part one, my biggest congratulations to all of you. I think this one task scares a lot of candidates, which is your endodontic access cavity preparation task. So let's dive deep into it and let's talk about new format tasks. Let's talk about what do we need to do in the endodontic access task. And I also want to talk to you about my online masterclass that is available for endodontic access for a lot of people who don't want to join the comprehensive course, who have already done some other courses. They just want help with endo. So today's video is all about that. Let's dive deep into it. Now, the first thing, which is very important, is you don't want to go into the psychology of getting clinical endodontic principle followed in this exam. Let me repeat it again. When you're looking at the endo-access cavity preparation task, you don't want to dive into with your clinical formula that you do in your clinical dentistry with this exam, because you're going to struggle big time. Now, the reason why ADC was not giving the lower molar endo in the past is that tooth is not designed correctly. And there's a bit of an issue with that tooth. So when you actually look at the upper molar, it still follows the science with the clinical dentistry. It still works out well. And that's why that was the only tooth that was coming in the past. Either the upper right six or the upper left six, 2-6 or 1-6. But now this formula has changed. So ADC likes that element of surprise that I call. And everyone knows what tasks come in the exam. So the moment you get something new, people get scared and stressed and they feel like, oh my God. However, if we logically think, it's not a very difficult task. I believe endodontic access cavity task is very easy task. You just need to know the right principles, right techniques, and to be able to formulate that and just work along with the basics. And if you can actually work with that, you'll notice it just works so much easier. Now, number one thing that you need to understand is, as I talk, don't follow your clinical science in your theoretical based science. Very important. Let me open a screen recording for all of you, and I'm gonna simulate that what I want you all to do when you're looking at this theoretical based exam format rather than jumping in the clinical exam. Let me open my recording. 1, 2, 3, and go. Let's look into this. Now, this is done by Clifford Riddle. We call him Endo Riddle. We call him godfather of endodontic, a godfather of endodontists. He's an amazing clinician. Endo Riddle has amazing videos on YouTube, amazing articles that you all can read, and we have learned so much from him when it comes to clinical endodontic principles. Now, this is one of the articles about access preparation. You can find out on Google. You should be able to find this article. You can find a lot of videos of Endo Riddle as well. Now, so it's Clifford J. Riddle. That's his full name, but he's famous for Endo Riddle. I'm like Dr. Murtaza Mak, so it's just like his nickname. If you'll notice, when we look at the clinical science it might be different to when you get a theoretical based exam. And I think that's the format you all need to understand, that previously, when you were getting a lot of formats like this in the exam, people come in because we all are dentists, we all are clinicians, we want to follow the same clinical format in the exam. But for your new teeth, especially for some of the other teeth as well, it does not work really well. And that's why I will be covering the 4 or 5 point that I want you to consider when you're doing your endo task. Okay, so let me go through this quickly with all of you. Access preparation science and opening for success. You can read this article, amazing article. It tells you about different science involved. But when you look into this, you'll notice this photo kind of like demonstrates for us the straight line axis, how the wall should be, what's the visualization. Now, when I look at something like this, I feel like dentists get really scared who are doing the exam. It feels like, oh, they've opened the cavity so much. But if we actually look at the grading criteria, sometimes opening more works better for you. Because what happens with endo? What is the biggest worry when you do endo task? Leaving any roof fails you. And I'm going to show you why sometimes removing more works better for you, because at the end of the day, you're more reliant, or your psychology should be on passing the exam, not about how the tooth looks. I have an amazing video on do not fall into the social media trap and 3 rules that I created for passing the ADC exam. You can go and watch those videos. They're going to be amazing for you to understand those psychology. Now, going back to the first thing, you should not care how the tooth looks, you should follow the guideline. And when you look at endo, the first thing is you're looking at a theoretical based science to pass the exam. You don't want to bring your clinical science too much to it, because this is a theoretical based exam. It's done on models and mannequins and teeth, which are not exactly a replica of your clinical situations that you normally see on a daily basis, especially for a lot of you experienced clinicians who have done a lot of endo. So put the clinical aside, have concept in your theory. Number two, which is again important, what is it? Number two is you should be following the straight line axis law, and you should be following, which is the most important, is do not leave any roof. And I always talk about this whenever you are in doubt in crown prep and endo, you should always remove more. Because guess what? Even if you leave a tiny bit of roof remaining, which I've seen a lot of academies train people to have being very conservative, and all of them are failing in the exam because they are doing so minimal access opening that they leave the roof. And even if there's a slightest doubt they've left the roof, they fail the whole exam. And I always say that read the grading criteria. And I'm going to be sharing that all my tips and tricks and secrets in my online masterclass for everyone. That I have a very systematic protocol on how to make endo so easy that everyone feels like, I wish I could have known about this before. So, one, keep your clinical science away, follow the theoretical based concepts. Second, work on your straight line axis, very important. Third, do not lose any roof, very important. Anytime you feel like any roof present, you're failing, so you have to kind of like be very religiously working on it, that whenever in doubt you remove more. Now let me go through another photo. Now this is what we see, the concept. And when you look at endo, not having a straight line axis, making sure when you see from a good clean occlusal view, we want to kind of like have a visualization from the top. On a straight clean occlusal view, you should see the canal orifice a good clean 90%. Anytime you don't see a 90% canal orifice, there's a high indication you've left the roof and you might be failing the exam. There's particular ways of looking at straight line axis and understanding it, but generally I always say when you look at a straight line axis, you should be able to visualize your canal. If you can't, then you're basically risking failing the exam. Now, we have been taught in different academies, and that's why I have this photo open about this. And we call this ninja axis or being very converging with the bold, and we call it conservative axis when it comes to endo. Guess what? It does not work in your theoretical based science. Very difficult when you look at this because there's a very high risk of you failing. Then we go back into these science in which we look at something and we say that, can you see where the lip of dentine is? That's basically exactly your roof. Because when we look at something like this is exactly, we see that that's something that you need to remove. So you should have a clean axis there. This has to be clean. So when you look from an occlusal view, you should see a clean canal orifice right there. Anytime you don't see it, that means you have been struggling with your straight line axis. That means there's a likelihood you'll be leaving the roof. It's so important to work on this principle. So looking at the ninja axis things and conservative axis, look at the grading criteria, read it. I have a special way of looking at it, and I do share it in my masterclass. But I want you to read the straight line axis rule. I want you to work on the grading criteria, follow it, read it, and say what it says. How much more can you remove even after removing the roof and you still land in satisfactory? So why are we so much worried and scared by different school of thought saying that you're removing more? Why you want to be so conservative? Because anytime in doubt, you'll fail the whole exam. Now let's go back and look into different signs. Now there's different signs of, straight line axis law, different signs of removing your correction of design of axis opening. You could read more about it. But when you actually follow the diagram, you actually notice the clinical significance of not having a clean straight line axis is you always end up leaving a roof and you end up missing any accessory canals. Like on the first molar, for example, MB2 is commonly missed because conservative axis missed out on it. Something that you need to be mindful of. Then this is again ultra conservative and ninja axis that we all are worried about, we want to stay away from. When you look at ADC task, this is something you should want to follow. Make sure you have a clean straight line axis. You should see the orifice of the tooth. Staying within your satisfactory criteria, but not leaving a risk of having um, leaving the roof there. And these are different laws and symmetries that you could follow, having a basic understanding of why is it so important to get the endo in the straight line. Then there's different anatomy principle that you want to follow and you want to kind of like correct and look into the science of what's the basic chamber principle. I have a previous video on endo axis on the upper molar that I do clarify some concepts, the most common asked questions, and how would you look into getting the axis opening. So you can go watch that video again. But this is summing up roughly about the upper teeth, and you'll notice how things are kind of like looking. Now, when we look into something like this, I genuinely believe with the upper tooth, you should be focusing on similar pattern, which actually works well. However, at the same time, when you look at from an occlusal view, you should see the canal orifices. And there's ways we predictably do that. Not removing more, not removing less, and still nailing on the head how to pass the exam while not being under. When you look at the upper first molar, premolar, you'll notice it gets trickier when you look at the lower molar and the upper premolar. The concept remains the same. You're not here to focus on the clinical science. You need to follow where the canal anatomy is taking you. Just remove all the roof, get the straight line axis, and that is all you want to do. The same phenomena you follow in the lower molar. Now, the problem which a lot of people struggle with is which burr to use. Now, I have a different formula that I follow with which burr to use, but there's different burrs and it really depends on person to person. I generally recommend you start with a round burr to get your start of your initial axis and kind of like drawing your outline. Then you should kind of like refine it with something which is a bit shorter, like a pear-shaped burr, or like a half axis of that long burr which you use for the crown preparation. Because when you use a really long burr like these ones, you end up touching the floor, which we don't want to. But at the end of the day, what your hand skills suggest you and your principle suggests you, you do that. The concepts remains the same. You just want initial opening. Make sure you follow the outline. You have a straight line axis. You're not leaving any roof. And at the end of the day, it doesn't matter how the tooth looks. You should follow the grading criteria. Keeping it simple like that. Now, the problem that generally a lot of people suffer with is the straight line axis law. What is it? And how to kind of like assess that. So if you actually look at it, you'll notice this is similar to the concept that you're doing. You are going in, diving deep into having an axis opening on this tooth, and then you're basically extending it to remove the roof to the point you're getting a bit more of a straight line axis. So when you look from an occlusal view right there, you could see canal orifice, you could see the canal orifice. Now the problem is we've been taught to be so conservative that by the time we get that outline from the top, it's so narrow that you can't even see it. And that's the problem that we say is there's a high indication that you might have left a roof there. And that is why it's so important to kind of like clean this up a bit more so you can start to visualize it better. And as I said, I have detailed, systematic way that I share in my online masterclass on EndoAxis, that you will get the basic outline from start to finish, how to follow each step along the way, and how to exactly understand what the ADC system wants on the pass and fail. That's all you need. But to look at the formula, what it is make sure you have that straight line axis. Make sure when you look from the top, you could see the canal orifice a good 90%. If you don't see it, you have a high risk of losing the exam. Then we look at the biggest issue that everyone has is that molar. Because they've started giving the molar endo now, and there's so much struggles with it. The problem is when you look at clinical relevance of an endo, and I will go back to a diagram to show you all. When you look at a lower molar, we've been taught this the entire life. We've been worked this as a clinician all our life that normally you have mesial canals and then you have distal canals. What normally happens is you have a mesiobuccal, mesiolingual generally, and then you'll have either a center canal, which is distal. Now, if the canal is kind of like coming in the center of the tooth, then it's one canal, which is distal. If you don't find the canal in the center, then that means it'll be two canals, distobuccal and distolingual, and there'll be four canal anatomy tooth. Now that's what been taught, and that's what we are basically trying to work on when we're looking for lower endomolar axis. We're looking at either a triangle axis opening, or we're looking at either like a rectangle axis opening, which I'll draw in a different color. Now the problem is happening is because we have this formula in our mind predetermined, when we go to the exam, we end up having bigger tooth, bigger axis openings. And that's where I say is you don't worry about how the tooth looks, you follow where the tooth is guiding you through, keeping the same formula in your mind, straight line axis, follow the principle that I've made, do not fall into the social media trap. Make sure you have no roof present following the outline of the tooth wherever the canal is taking you and following that principle. And if I actually go back and see, you'll notice if you see the ADC exam, you might actually get two canals, just one here, one here. Or maybe the mesiobuccal and mesiolingual are so joined together, it's literally like this. So what you do now, if you follow the clinical signs, you fail. But if the tooth is guiding you differently, you're basically guiding the tooth. And that's why it's so important to know the grading criteria, work with the principles, and you exactly follow it. And that's where people are struggling. They have their clinical science, they want to take it to their practical science, they want to combine it together, and they fail the exam. So, what you need to do is forget about your clinical science, look at your grading criteria, remember your straight line axis rule, remember that you can't leave a roof in this exam, and then just follow it like a puzzle, solve it like a puzzle, and let it guide you the anatomy of the tooth, where it's taking you. So if I go back to the molar endo, and this is the law of symmetry that you all will see, and you can kind of like follow that on internet, readily available on so many amazing dentists who have shared it. You can look into the canal signs and everything, and you'll notice this is your molar endo. Now you'll notice the problem is when someone went in there, they predetermined went and opened a bigger circle because they felt like they're going to get a rectangle or a triangle. So they already opened big canals right there. But what happened? The canal was small. The canal was joined together. And you'll notice they've opened extensively on here, which is your red, or I'll mark it as something else color like blue. So they marked it this, they thought this was the canal opening. And what happened? All that is their excess. All that is excess. Remove too much. And worst bit is the distal still has a shadow. That means they have not removed it. So that's roof present there. So that's the biggest takeaway home message is when you're doing your endo task, you need to follow the signs behind straight line axis. Do not remove any roof. Do not leave any roof. Sorry, you have to remove all the roof. Do not follow what the clinical science telling you. You follow the theoretical science and let the truth guide you. And that is the main reason why ADC was not giving the lower molar in the first place, because they were not the correct tooth to work with. They were not following the guidelines of what a natural tooth that we see in clinical dentistry. And this was not the truth. But because everyone has already seen all the tasks, they're trying to give you that element of surprise. So if they're giving you a lower molar or an upper premolar or endo on the first molar, principle remains the same. You want to make sure there's no roof. You want to make sure you have a straight line axis concept clear in your mind. Do some research on it. You need to understand that you're not following the clinical science. You have a theoretical based approach on what the exam wants. You exactly know the grading criteria, and then you don't leave a roof. That is all you need to do. So I want you to follow this exam like a puzzle. You want to have those 5 principles in your mind if you do it. Now, I have a detailed online masterclass available on endodontic access cavity that's going to guide you through in terms of how to have your access opening, how to have the basic concept of straight line access, what does the exam needs to pass and fail. It's going to teach you about the upper molar, lower molar, premolar, and some bonus content and bonus videos on how to refine the cavity. When you finish your endo, how to know that you've removed enough, you've removed too much, and where is that middle line where you say that this is bingo, I'm 100% passing the exam. And that's what I would like all of you to kind of like understand. And when you learn from any mentor out there, you don't want to get too much excited or distracted with how the tooth looks. You want to know exactly what passes you and what fails you with this exam format. And that is what you all need. I hope this video clarifies a lot of your confusions. If you would like, I will leave the details of my online masterclass for Endo Access. Anyone can join it. You get 14 days access. You could review all the videos multiple times. It's going to clarify all your concepts and details. And I wanted to have that masterclass separately because so many people have already done different courses from other clinicians. They might want to not do the full comprehensive course that I have. They just want to learn the endoscience. This course is for all of you. For all of you who are doing training and they're struggling with endo, I hope this is like an eye opener for all of you. So I would like you to work on these 5 principles, and it's going to make your endo a lot more predictable in terms of you passing the exam and getting good results in the exam. I wish you all the best, and I see you all in the next video. Again, if you like this video, share it with someone who can benefit out of it. If you have any questions, or if you like me to discuss any other topic that you really want me to, leave a detailed comment below. And I see you all in another video, another day. God bless you. Dr. Mac signing off.
Your lips are still glowing.